Dr. Vikisha Fripp is a plastic and reconstructive surgeon at Providence Hospital. We're glad to have you here today to talk about plastic surgery, reconstructive surgery, and cosmetic surgery. You know, I was telling the guys in the studio, I lump it all together. You know, I use plastic surgery when I mean cosmetic surgery.
Right.
So let's take it one step at a time. What is plastic surgery?
It's such a great question. Plastic surgery is really the cosmetic side of what we do. So the true name is plastic and reconstructive surgery. So plastics are the good things we do for ourselves, the little liposuction, little Botox, little fillers, to make ourselves feel better and to augment our appearance.
So a lot of that is on the face.
A lot of that's on the
fillers
face, but a lot of other areas we build confidence when we have a better shape. And so after we've had the trauma of childbirth, it is sometimes required for us to have a little intervention.
That's right.
And so that's when we do the liposuction, we do the tummy tucks, we do
and
the
you
breast
can do
lift.
partial and
Absolutely.
whole
We don't have
tummy
to do a
tucks.
full. The issue is when patients don't know and they try to dictate to us what they need. You really need to get the advice and make a decision together instead of taking the advice of the street doctors.
So they come in and I know it, and they show you the Kim Kardashian picture and they say, I want to look just like that. And they don't have anything that's going to help. How do you manage expectations?
Oh, such a great question. What I do first is tell them that the things they have in common with Kim Kardashian, that they breathe oxygen. and so then after that,
that's it.
That wraps it up. And so what I do is ask them to bring the best picture of themselves in, and we can work to restore that look. Because you can't think that Kim Kardashian is the standard.
That's right.
Because she has a different bone structure, you don't know what her ethnicity is, her genetic makeup. And so let's work on being the best you, and we can probably get really close to that. And they get it. Those that don't get it, we like to just refer them to see someone else, because we want to make sure our patients are happy and that we both end up after surgery smiling.
That's right, that's right. So when we talk about reconstructive surgery, now we're looking at possible injuries or loss of limbs.
Right. Or post-cancer. So I do a lot of post-mastectomy work. So it is unfortunate that breast cancer affects 1 in 8 women, but if you know 8 women, you'll know someone with breast cancer. And so afterwards, we want to feel whole too. And a lot of times the old thinking was just remove the breast, cure the cancer, she'll be okay, she has her grandchildren.
Right.
Well,
what is that?
What does that have to do with the relationship she has with her spouse?
And how she feels about
herself? We used to give them this bra with this insert in it, and then in the summertime it would perspire, or then you would move and it would be lopsided, and that was okay. It was even okay where I worked until I got there, because there were senior surgeons who were male and didn't care or know too much about it. So I had a whole initiative, and now we offer every woman who is diagnosed with breast cancer a consultation with a plastic surgeon.
This is why it is important to have diversity, because a man is going to understand it at a certain point, but when it comes to me, I need a woman who can understand what I'm going through.
You do. Plus, you want to know what your options are.
Exactly.
And I think life is about information. Okay, I have cancer. It is devastating.
Right.
But you should see the look on their face when I go through the options and they think there's something I can do.
Yeah.
Now, every option is not for everyone.
That's right.
It's not. But we can find something other than that bra with that heavy plastic insert in it for you to live with the rest of your life. Remember, we're diagnosing in 30s and 40-year-old women.
Yeah.
So for the 60 years, I'll have this bra. Why don't we do something with the tissue that you have?
That's right.
And move that and create a breast mount or do implants. You may have the breast you've always wanted.
There you go.
So there may be a ray of sunshine. Right.
Not here,
not here. There may be a ray of sunshine with this cancer diagnosis.
That's right.
I get breast.
That's right. That's exactly right. I'm going to do something I always wanted
to do. And then engage in society. Be a good parent. Be a good partner. Be a good worker. Be a good friend. You're able to be yourself then.
Right. Tell me, have you ever had someone walk into your office like this Heidi, what was her name?
Oh, yeah.
Heidi Montag, what was her name?
Heidi Montag.
Thank you. Who, you know, they say, pretty girl, low self-esteem, and she wants 1,001 surgeries all at once, and she kind of really wants to look like Barbie doll. Are you insane? How do you handle that?
What I do is, it depends on if I can see what they want. So if they say, listen, I want to have larger breasts, you know, there's a limit based on how big you are. how wide your arms
That's
are,
right.
and how big an implant you can have. And so I show them the list. So if they see that list and still want something outside of that list, then we bring it back into my office and we have a sit-down conversation about what our goals are.
Can I just tell you, I was recently looking for bras.
Okay.
And without telling my bra size, which is pretty easy to figure out, I kept screaming, going, what is this? Who's a 32 double G?
Right.
What is that?
Right.
It's people getting breast implants.
It is.
It didn't occur. Mike, where's the 32As?
Right.
Who's got the 32 double Gs?
Right, and it's because when a patient comes in, remember this is cash.
Right.
And you know what they say, cash rules the
Doctors
world.
making a lot of money
You know
because
what
it's
they
cash.
say. You know what they say.
Yeah.
And so who really turns down cash?
I know. You better not turn down.
So you have to think about it.
Yeah.
For me,
Yeah.
I have to think I don't want to wear an orange jumpsuit and have my hair in braids. And that's the reality.
And that's the
And
reality.
so I don't want to be in anybody's jail.
Right.
And so I will gladly send that patient on down the street until she finds. The same thing with Michael Jackson. He had one nose, he had
Yes.
two, he had three by board-certified plastic surgeons. When he wanted the fourth, he was told no, so he found somebody.
Yes.
Because he showed up with cash.
Cash.
But for me, I have 3 people that depend on me, and I want to be present.
That's right.
And not looking through the glass, putting my hand against their hand.
That's right.
And so,
with Big Sally.
right.
That's
with-
right.
oh God, you know, I'd be someone's girlfriend first. And so I pass. I pass. And it is an uncomfortable conversation, but to be honest, when you get to the root of why they're doing it, they want
Right.
to save a marriage.
Yes.
They think it'll get a better job, a
Yes.
promotion.
Yeah.
And when you really get to the root of that, you can then counsel them about that.
Yeah.
Right.
By the way, do people have to go to psychological counseling prior to?
It depends. If it's the run-of-the-mill, I want a breast augmentation, I can see why they want it, I want liposuction here, I can see why they need it, then no. But if you have a person who's a repeat offender, who's now getting their fourth procedure, then I say, before we do any more, can we talk to someone first? Because everyone should talk to someone in the span of your life.
Absolutely.
We'll just move that time up and let them talk to someone sooner than later.
Dr. Vikisha
true.
Fripp, plastic and reconstructive surgeon at Providence Hospital. You're great.
Thank you.
Anytime I think about getting something done, I'm gonna come over there to get a little
I need
nip
more
and
than
tuck with you.
$5, so no.
I understand.
You're not a candidate.
Doctor, thank you. You were
Thank
a
you.
delight, a sheer
My
delight.
pleasure.